Memory lapses are a common concern for many people, especially as they age or experience periods of stress. Forgetting names, misplacing items, or struggling to recall information can be frustrating and sometimes worrying. While occasional forgetfulness is normal, some individuals look for over-the-counter, or OTC, solutions to help boost their memory. In this video, we'll explore which OTC medicines are commonly used for memory lapses, how they work, and most importantly, who should avoid them. We'll also touch on the importance of consulting a healthcare professional before starting any new medication, even those available without a prescription. OTC, or over-the-counter medicines, are drugs that can be purchased without a prescription. They are widely available in pharmacies, supermarkets, and even online. These medicines are generally considered safe for most people when used as directed, but that doesn't mean they are risk-free. Some OTC products are marketed for improving memory or cognitive function, but their effectiveness and safety can vary. It's essential to understand what these medicines are, how they claim to work, and the potential risks involved before considering them for memory lapses. Several OTC products are commonly used by people hoping to improve memory or cognitive performance. These include herbal supplements like ginkgo biloba, vitamins such as B12, and other compounds like omega-3 fatty acids. Some people also use caffeine-containing products or nootropic blends that claim to enhance mental clarity. While these are easily accessible, it's important to note that the scientific evidence supporting their effectiveness is often limited or mixed. Let's take a closer look at each of these options and what you should know before trying them. Ginkgo biloba is one of the most popular herbal supplements used for memory enhancement. Derived from the leaves of the ginkgo tree, it is believed to improve blood flow to the brain and act as an antioxidant. Some studies suggest that ginkgo may offer modest benefits for memory, particularly in older adults. However, results are inconsistent, and not everyone experiences improvement. Side effects can include headaches, dizziness, and digestive upset. It's also important to be aware of potential interactions with other medications, especially blood thinners. While ginkgo biloba is available without a prescription, it is not suitable for everyone. People who are taking blood thinners, such as warfarin or aspirin, should avoid ginkgo due to an increased risk of bleeding. Those with a history of seizures or epilepsy should also steer clear, as ginkgo may lower the seizure threshold. Pregnant or breastfeeding women, as well as individuals scheduled for surgery, should consult their doctor before using ginkgo. Always check with a healthcare provider if you have any underlying health conditions or are taking other medications. Vitamin B12 is an essential nutrient that plays a key role in brain health and nerve function. Deficiency in B12 can lead to memory problems, confusion, and even neurological damage if left untreated. OTC B12 supplements are often used by people who suspect they may be deficient, such as older adults or those with certain dietary restrictions. While supplementing B12 can help restore normal memory function in deficient individuals, it does not enhance memory in people with normal B12 levels. It's important to identify deficiency before starting supplementation. Vitamin B12 supplements are generally safe for most people, but there are some exceptions. Individuals with certain rare medical conditions, such as Leber's disease, should avoid B12 supplements due to the risk of optic nerve damage. People with allergies to cobalt or cobalamin should also steer clear. Additionally, those with kidney disease should consult their doctor before taking high doses of B12. As always, it's best to confirm a deficiency with a healthcare provider before starting any supplement. Omega-3 fatty acids, found in fish oil and some plant sources, are another popular OTC supplement for brain health. They are thought to support cognitive function and may help slow age-related memory decline. While some studies show modest benefits, especially in people with low dietary intake, the evidence is not strong enough to recommend omega-3s solely for memory improvement. Side effects are generally mild, such as fishy aftertaste or mild digestive upset, but high doses can increase bleeding risk. Omega-3 supplements are not suitable for everyone. People who are allergic to fish or shellfish should avoid fish oil products. Those taking blood-thinning medications or with bleeding disorders should use caution, as omega-3s can increase bleeding risk. Pregnant or breastfeeding women should consult their doctor before starting omega-3 supplements. As with any supplement, it's important to discuss potential interactions and risks with a healthcare provider. Caffeine is a well-known stimulant found in coffee, tea, and many OTC products. It can temporarily boost alertness and concentration, which may help with short-term memory tasks. However, caffeine does not improve long-term memory or prevent memory decline. Overuse can lead to side effects like jitteriness, insomnia, and increased heart rate. People with certain health conditions or sensitivities should be cautious when using caffeine-containing products. Caffeine is not suitable for everyone. People with heart conditions, anxiety disorders, or sleep problems should limit or avoid caffeine. Pregnant women are advised to restrict caffeine intake due to potential risks to the fetus. Children and adolescents should also avoid high caffeine products. If you experience side effects like palpitations or insomnia, it's best to cut back or stop using caffeine-containing OTC products. Nootropic blends are OTC products that combine various ingredients, such as herbs, vitamins, and amino acids, to claim cognitive enhancement. These blends often include substances like ginkgo, caffeine, and B vitamins. While they are marketed for memory and focus, scientific evidence supporting their effectiveness is limited. The safety of these combinations is also not well studied, and there is a risk of side effects or interactions with other medications. People with underlying health conditions, such as heart disease, high blood pressure, or psychiatric disorders, should avoid nootropic blends. These products may contain stimulants or other ingredients that can worsen certain conditions. Pregnant or breastfeeding women, children, and those taking prescription medications should also avoid these blends unless advised by a healthcare professional. Always read labels carefully and consult your doctor before trying new supplements. Some OTC antihistamines, especially first-generation types like diphenhydramine, Benadryl, can cause drowsiness and impair memory or cognitive function. These medicines are often used for allergies or as sleep aids, but they can have unwanted effects on the brain, particularly in older adults. Long-term or frequent use may contribute to confusion or memory problems, so it's important to use these medicines with caution. Older adults, people with dementia, and those with a history of confusion or cognitive impairment should avoid first-generation antihistamines. These medicines can worsen memory problems and increase the risk of falls or accidents. Individuals with glaucoma, enlarged prostate, or certain heart conditions should also be cautious. Always check with a healthcare provider before using these medicines, especially if you have underlying health issues. OTC decongestants, such as pseudoephedrine, are used to relieve nasal congestion, but can also affect the brain. These medicines may cause nervousness, insomnia, or even confusion, especially in sensitive individuals or older adults. While they are not typically used for memory, their side effects can indirectly impact cognitive function. It's important to use decongestants only as directed and be aware of potential risks. People with high blood pressure, heart disease, or thyroid problems should avoid OTC decongestants, as these medicines can raise blood pressure and heart rate. Older adults and those with a history of confusion or insomnia should also be cautious. If you are taking other medications, check for potential interactions. Always consult a healthcare provider if you have any concerns before using decongestants. Acetaminophen, commonly known as paracetamol, is an OTC pain reliever and fever reducer. While it is not typically associated with memory improvement or decline, some studies suggest that overuse or misuse of pain relievers may have subtle effects on mood or cognitive function. However, when used as directed, acetaminophen is generally considered safe and does not directly impact memory. People with liver disease or heavy alcohol use should avoid acetaminophen, as it can cause liver damage. Those who take multiple medications should check for acetaminophen in combination products to avoid accidental overdose. If you have any concerns about using acetaminophen, consult your healthcare provider for guidance. Some OTC medicines, such as certain sleep aids and allergy medications, have anticholinergic properties. These drugs block acetylcholine, a neurotransmitter important for memory and learning. Long-term use of anticholinergic medicines has been linked to an increased risk of memory problems and even dementia, especially in older adults. It's important to be aware of these risks when choosing OTC products. Older adults, people with dementia, and those with a history of cognitive impairment should avoid anticholinergic OTC medicines. These drugs can worsen memory and increase confusion. Individuals with glaucoma, urinary retention, or certain heart conditions should also be cautious. Always consult a healthcare provider before using these medicines, especially if you have multiple health concerns. Bacopa monnieri is an herbal supplement sometimes used for memory enhancement. It has a long history in traditional medicine and is believed to support cognitive function. Some small studies suggest potential benefits, but more research is needed to confirm its effectiveness and safety. Side effects can include digestive upset and fatigue. As with other supplements, it's important to use caution and consult a healthcare provider before starting Bacopa. People who are pregnant or breastfeeding should avoid Bacopa monnieri, as its safety has not been established in these groups. Those with thyroid disorders or digestive issues should also use caution, as Bacopa may worsen symptoms. Always consult a healthcare provider before starting any new herbal supplement, especially if you have underlying health conditions or take other medications. Acetyl L-carnitine is an amino acid supplement sometimes used for memory and cognitive support. Some research suggests it may help slow cognitive decline in older adults or those with mild memory problems. Side effects are generally mild, but can include nausea, restlessness, or a fishy odor. The evidence for its effectiveness is still limited, and more research is needed to confirm its benefits. People with a history of seizures should avoid acetyl L-carnitine as it may increase the risk of seizures. Those with thyroid disorders or taking blood-thinning medications should also use caution. Pregnant or breastfeeding women should consult their doctor before using this supplement. As always, discuss any new supplement with your healthcare provider to ensure it is safe for you. Vitamin E is an antioxidant that is sometimes used in hopes of protecting brain cells and supporting memory. Some studies suggest that vitamin E may help slow cognitive decline in people with mild to moderate Alzheimer's disease, but it does not appear to benefit healthy individuals. High doses of vitamin E can increase the risk of bleeding and other side effects, so it's important to use supplements cautiously. People taking blood-thinning medications, such as warfarin, should avoid high doses of vitamin E due to an increased risk of bleeding. Those with vitamin K deficiency or bleeding disorders should also be cautious. Pregnant or breastfeeding women should consult their doctor before using vitamin E supplements. Always use the lowest effective dose and discuss with your healthcare provider. Choline is a nutrient important for brain health and memory. Some OTC supplements contain choline or related compounds, such as alpha-GPC or citicoline, which are marketed for cognitive support. While choline is essential, most people get enough from their diet, and the benefits of supplementation for memory are not well established. Side effects are rare, but can include fishy body odor or digestive upset. People with certain genetic conditions affecting choline metabolism should avoid high-dose choline supplements. Those with liver or kidney disease should also use caution, as excess choline can cause complications. Pregnant or breastfeeding women should consult their doctor before using choline supplements. As always, discuss any new supplement with your healthcare provider. Ginseng is an herbal supplement sometimes used for boosting energy and cognitive function. Some studies suggest it may offer mild benefits for memory, but the evidence is not strong. Side effects can include insomnia, headaches, and digestive upset. As with other herbal supplements, quality and potency can vary between products, so it's important to choose reputable brands and consult a healthcare provider before use. People with high blood pressure, diabetes, or hormone-sensitive conditions should avoid ginseng, as it can affect blood sugar and hormone levels. Pregnant or breastfeeding women and those taking certain medications, such as blood thinners or antidepressants, should also use caution. Always consult a healthcare provider before starting ginseng or any new supplement. Melatonin is an OTC supplement commonly used for sleep problems. While it is not a memory enhancer, getting enough restful sleep is crucial for memory consolidation and cognitive function. Melatonin may help regulate sleep patterns, especially in people with insomnia or jet lag. Side effects are usually mild, but some people may experience drowsiness or vivid dreams. People with autoimmune diseases, depression, or seizure disorders should avoid melatonin unless advised by a doctor. Pregnant or breastfeeding women and children should also use caution. Melatonin can interact with certain medications, so always check with a healthcare provider before starting this supplement. Iron is an essential mineral for brain function, and deficiency can lead to problems with concentration and memory. OTC iron supplements are used to treat or prevent deficiency, especially in women, children, and people with certain medical conditions. However, excess iron can be harmful, so supplements should only be used when deficiency is confirmed by a healthcare provider. People with conditions like hemochromatosis or other iron overload disorders should avoid iron supplements. Those with liver disease or certain infections should also use caution. Always confirm iron deficiency with a healthcare provider before starting supplementation, as unnecessary use can cause serious health problems. Magnesium is a mineral involved in many bodily functions, including nerve transmission and brain health. Some people use magnesium supplements to support memory and reduce brain fog. While deficiency can cause cognitive symptoms, most people get enough magnesium from their diet. High doses of supplements can cause digestive upset or interact with certain medications. People with kidney disease should avoid magnesium supplements, as their bodies may not be able to eliminate excess magnesium, leading to toxicity. Those taking certain medications, such as antibiotics or diuretics, should also use caution. Always consult a healthcare provider before starting magnesium supplements, especially if you have underlying health conditions. Zinc is another mineral important for brain function and immune health. Some people use zinc supplements to support memory, especially if they have a deficiency. However, high doses of zinc can interfere with the absorption of other minerals and cause side effects. Most people get enough zinc from a balanced diet, so supplements are only needed if a deficiency is confirmed. People with kidney disease or certain genetic disorders should avoid high-dose zinc supplements. Those taking medications that interact with zinc, such as antibiotics, should also use caution. Pregnant or breastfeeding women should consult their doctor before using zinc supplements. As always, confirm deficiency before starting supplementation. While many OTC medicines and supplements are marketed for memory support, their effectiveness and safety can vary widely. Some may offer benefits for people with specific deficiencies or conditions, but others may pose risks, especially if used inappropriately. It's important to weigh the potential benefits against the risks and to use these products only when truly needed. Always read labels carefully and follow dosing instructions. Before starting any OTC medicine or supplement for memory lapses, it's crucial to consult a healthcare provider. They can help identify underlying causes of memory problems, recommend appropriate treatments, and check for potential interactions with other medications. Self-medicating without guidance can lead to unwanted side effects or mask serious health issues. Your doctor can also help determine if a supplement is necessary or if lifestyle changes may be more effective. In addition to or instead of OTC medicines, there are many lifestyle strategies that can help support memory and cognitive function. These include regular physical activity, a balanced diet rich in fruits and vegetables, adequate sleep, stress management, and staying mentally active through learning and social engagement. These habits not only support brain health, but also benefit overall well-being. While occasional forgetfulness is normal, certain warning signs may indicate a more serious problem. These include frequent memory loss that interferes with daily life, difficulty performing familiar tasks, confusion about time or place, and changes in mood or personality. If you or a loved one experiences these symptoms, seek medical advice promptly. Early diagnosis and treatment can make a significant difference. To sum up, several OTC medicines and supplements are used for memory lapses, but their effectiveness and safety vary. It's important to understand who should avoid certain products and to consult a healthcare provider before starting any new medicine or supplement. Lifestyle changes often play a crucial role in supporting memory and overall brain health. Always prioritize safety and informed decision-making when considering OTC options for memory support. Memory lapses can be concerning, but there are many ways to support brain health safely. While OTC medicines and supplements are widely available, they are not a one-size-fits-all solution. Understanding the risks, benefits, and who should avoid certain products is essential. Always consult with a healthcare professional before making changes to your medication or supplement routine. Remember, a healthy lifestyle and proactive medical care are your best tools for maintaining memory and cognitive function.